Bismillahirrahmanirrahim. Assalamu alaikum. Today the topic is cholangitis. It is basically an inflammation or infection of the biliary tract or the biliary tree. Let's first have a look at the biliary system. Liver is made up of intrahepatic and extrahepatic ducts. The intrahepatic bile duct system is present inside the liver, which carries bile inside the liver. These are also called ductules. And the extrahepatic ducts are a part of a network of ducts that carry bile from the liver and gallbladder to the small intestine. This is the liver, and inside the liver there is a intrahepatic ducts. When we consume dietary fat, this liver produces bile which travels from the common hepatic duct and is stored in a gallbladder. This gallbladder releases bile into the common bile duct through the cystic duct. The common bile duct, which receives pancreatic secretions and enters the small intestines through the papilla of water. Now, the types of cholangitis. There are basically 4 types of cholangitis. The first one is primary biliary cholangitis. It is a chronic disease in which the small bile ducts inside the liver, which is called ductules, get inflamed and scarred and eventually destroyed. When there are no bile ducts inside the liver, the bile gets built up and causes liver damage. The persistent primary biliary cholangitis leads to primary sclerosing cholangitis. In this type of cholangitis, the inflammation and scarring of the bile ducts occurs both inside and outside of the liver. Over time, it becomes worse and ultimately narrows or plugs the bile ducts. Bile accumulates in the liver as a result of this, endangering the organ and resulting in the cirrhosis and liver failure. Now, the third one, acute bacterial cholangitis. The extrahepatic biliary system of liver gets infected with germs. In this case, gallstones are typically the major reason that obstructs the common bile duct. In this case, increased bacteria endotoxin starts circulating in the lymphatic and vascular system. Endotoxins are basically a poisonous substances that are normally present in different types of bacteria like E. coli and Klebsiella. Now, the fourth one is IgG4 autoimmune cholangitis. This type of cholangitis is caused by the abnormally or the overregulation of immune system. It is very much common in the middle age to elderly individuals and very much seen in males as compared to females. Normally, it affects multiple organs like sometimes gallbladder, pancreas, lungs, kidneys, bile ducts. Now, the causes of cholangitis. The major cause is bile stones. These bile stones basically obstructs the flow of bile throughout the bile tree and cause inflammation, scarring and strictures. There are certain factors that triggers the autoimmune disorder like gut dysbiosis, infections, dietary components, lifestyle and toxic chemicals. The third one is bile duct injury due to bile acids. These bile duct injuries leads to the inflammation, scarring and sometimes the oxidative stress as well. And these oxidative stress leads to the cancer and cirrhosis. Genetic disorder is one of the major cause of cholangitis. Thank you so much.